I had definitely firsthand experiences with the multiple barriers that patients that I see nowadays face. One day, I was on the hospital hallways. I ended up actually passing out, and when I was sent to the urgent care, that's where I actually learned that I was pregnant. By the time everything was collected and done, I was already past the time frame to do the medication abortion. And I just remember, walking into the clinic, walking past all of the protesters. That decision was already hard enough as it was, but to have to, feel further shame just made it even more difficult and traumatic. The doctor that was doing the procedure, I only saw him for 2 seconds that I remember. So I felt like it was very, unfortunately impersonal. And it was from that moment and that experience that I decided I wanted to be an abortion provider myself and to help change those demographics, to not only be like a woman physician, but also someone who had experienced it and could hopefully make it a much more compassionate and patient centered experience. In medical school, we have no real curriculum for abortion care at all. It was maybe 1 hour of a lecture. Um, so I had to seek extracurricular activities to really get the abortion training. We went into local youth shelters and we did sexual health counseling, options counseling. And I remember even at that time, there were protesters, even children were at the protests at the abortion clinics. And at the local youth shelters, if they had any religious affiliation, we couldn't even like bring condoms or do our condom demonstrations during our educational programs. I knew I wanted to work in underserved medicine, specifically at a federally qualified health center. I was very hesitant to have, my competency in providing abortion care on my resume because I feared missing out on opportunities or being judged. You kind of get like a scarlet letter sometimes by advertising yourself as an abortion provider. I ended up, interviewing with these jobs. A faculty member that I spoke with said basically, you would have to decide between working here and continuing your work with Planned Parenthood. And even if I wanted to do it on the side, like moonlighting, they wouldn't allow it. To be turned away for being an abortion provider, I definitely felt discriminated against. Just because, in my view, abortion care is healthcare. Like I'm having to set aside and um, uh, things that I don't have to do for any other aspect of care that I provide. If I'm managing diabetes or asthma or smoking cessation, I don't get any of this similar type of discrimination. It's heartbreaking and it's gut wrenching to feel that members of my own medical community are not incorporating the care that I see as essential to being a good doctor. We were already seeing an uptick in our patient volume because we were having to accommodate folks from, places like Texas. Um, and so we were anticipating that we would only be seeing more and more patients. There's been patients who were minors, for example. This 14-year-old, from my understanding, was living with an uncle. From what we could gather, we think that the pregnancy was a result of the uncle raping her very sadly. She didn't really keep, uh, track of her period. She thought she was, less than 12 weeks. But when we did the ultrasound, when we had to reveal to her that she was 17 weeks, and we don't have a exception for rape or incest in our state, to see that um, reaction, of shock and even trying to counsel and um, get her to comprehend because of the law we couldn't proceed with her care. It's not because we don't have the medical means to provide her care. It's just because it's what the lawmakers have decided. How do you explain that to a patient? How do you justify that? She's just so vulnerable already, and to say we have to refer you somewhere else, whereas we would have been able to seen her if it was just maybe a few weeks earlier, or if, if it was a different zip code, things that are just, beyond their control. It feels like we're withholding care, honestly, and we're just not meeting the patients where they're at, because of the restrictions. Just because abortion is banned does not make it any less, of a service that's needed. It's something that, again, won't go away just because the law changes. If I can empower not only myself but my colleagues and future trainees, to be those partners and advocates for the patient, so that they, don't have to fear losing their own, ability to make decisions for themselves, and without, feeling like, that there's personal or paternalistic or patriarchal intrusion into their health and that decision. That would really, I think, be the key. Whatever the case may be, having it as a viable option is so important to me in what I do.